The new health care reform proposals have been successful at one thing, scaring people to death, literally. I'm joined this morning by Myrna Olphick and her husband, Bob. Good morning to both of you.
Good morning.
And thank you for being here. Myrna, you are suffering from 2 forms of cancer, and you are afraid of what this health care proposal will do for people like yourself. Why?
I'm deathly afraid. I'll tell you why. Because I feel that eventually there's going to be no more Medicare, and that's what I need to stay alive. I have Medicare right now, and I have the freedom to go to any doctor I want to go to. I have the freedom to have scans to monitor my cancer, and that's very, very important to everyone, not only seniors, but everyone out there. And let me tell you something. Congress has proposed a $500 billion cut in Medicare over the next 10 years, and only 1% is going to go for fraud, to root out fraud. Now, that is unconscionable. I believe that that's one of the points I want to bring out. And also, on page 273 of the House bill, there's a provision for, what is it, Bob?
If I was to read it.
You have apparently read more than members of Congress, which is impressive.
I would call it a stealth cut, because it says here that they're going to amend 42 U.S.C. 1395W. Now, would you know that that's Medicare?
No.
No. And they're going to adjust the utilization rate from 50% to 75% of imaging equipment. But what that really is 35% off the reimbursement for MRIs.
And that is what the President has talked a lot about. He says these things that don't necessarily make you healthier, you might have to sacrifice. But what do these tests mean?
Okay,
right,
these tests mean to me of vital importance. I'll tell you why. 2 things were found in my body from these wonderful tests that I take. They found a uterine cancer in a very early stage. I had a hysterectomy done 6 months ago. I was on a treadmill walking 2 days afterwards. They found an aggressive lymph nodule in my lung. They took that out. Otherwise, I would have been under chemotherapy treatment. They're monitoring me on scans, and I must have that to be alive. I'm 68 years old. I got this cancer when I was 59, and I'm still walking. And I think it's because of my team of doctors, my oncologist, who is wonderful, who gets up 4 in the morning and sees all his patients till 7 o'clock at night. His name is Dr. Goldenberg. He's marvelous. And my team of radiologists, Dr. Neistat, and I have to mention them because they're marvelous.
Certainly you do. And you are clearly a fighter. The President, those of Congress might argue that there are people that have no insurance right now, that don't have the wonderful care that you have, many millions of them. How would you answer that?
Okay, I would answer that. First of all, they say there's 40, what is it, 40?
They say there is roughly 47 million, which we say maybe 18 million.
Okay, I would think that out of that millions, I don't know how many exact, I think about 12 million are about illegal aliens. I think that's one of the things we should consider. And also, there are people who really don't want insurance. They don't want it. I've spoken to people. They say they're working. Excuse me. Excuse me. They're working right now, and they're putting away savings, so therefore they can go to their own doctor whenever they want, whenever they feel like, and pay for it. Well, so you got to take those 12 million, add that to the other 12 million. That's 24 million that you can push aside.
Myrna and Bob Olphick, we really appreciate you being here, and the best of luck on your treatment. And it's just wonderful to see the energy and the fight you have in you.
Thank
if only
you
everyone
so very
could attack
much.
it that way.
Thank you.
Spirit does count.
Spirit
it
does
certainly
count.
does, and you are
Thank
proof
you.
of that. Thank you very much. Well, come